Hi friends, from today onward, I am going to start a new video series on general examination or bedside examination. I will be discussing the each system for examination purpose of our exam going medical students and practitioners. In this video, I will talk about the pulse, what we look in the pulse, how do we palpate the pulse, what are the causes of bradycardia, tachycardia, and what is relative bradycardia and relative tachycardia. First is the disclaimer. Caring Dogs YouTube channel does not provide medical advice, and information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only, and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. This is a case sheet format for a patient who is admitted in our ward. We have to see whether the patient is conscious, oriented, cooperative, obeying commands, check his weight, and calculate body mass index. Body mass index is weight in kg divided by height meter square, and then grade it according to World Health Organization guidelines. Coming to vital examination, whenever we check the pulse, we calculate its rate, rhythm, volume, character, basal wall thickening, radio-radial delay and radio-femoral delay, peripheral pulses. In the blood pressure, we check in the right arm, left arm, both legs, patient in supine position, patient in sitting position, and standing. In the respiration, we check for rate, whether rate its character, whether it is abdominothoracic or thoracoabdominal, jugular venous pulse, usage of any accessory muscles, jugular venous pulse, various waveforms, JVP, jugular venous pressure, which is calculated as centimeters of blood or water above the sternal angle. Whenever we check the temperature of the patient, we have to write where did we check the temperature, that is site, whether it is oral or taken in the armpit or axilla or rectal temperature. We have to mention it in Celsius or degree Fahrenheit. We have to check the SpO2 with pulse oximetry, and similarly if the patient has pain with the visual analog scale, we have to grade it. In physical examination, general physical examination, we will check for any pallor, icterus, cyanosis, clubbing, lymphadenopathy, or edema. General physical examination findings related to each system will be discussed subsystem wise in my upcoming different videos. Coming to the pulse, pulse is defined as a pressure distension wave produced by contraction of the left ventricle against a partially filled aorta, which is transmitted to peripheries and is felt on the peripheral arteries against a bony prominence. Whenever we assess the arterial pulse, we check rate, rhythm, volume, character or quality, and radio-radial and radiofemoral delay, whether all peripheral pulses are felt, and condition of the vessel wall. These all findings we have to check and tell to the examiner. The rate and rhythm are usually seen in the radial artery. They are better appreciated in the radial artery. Volume of the pulse is assessed in carotid artery. Character or quality is also assessed in carotid artery. Exceptions are there for character or quality, collapsing pulse, pulses alternance, pulses paradoxes. They are appreciated better at radial artery, and pulses variance is best appreciated in the brachial artery. Whenever we tell about the pulse to the examiner, we have to tell in this way. Like if the patient has a pulse rate of 72, we will say patient is the pulse rate is 78 beats per minute, regular rhythm, normal volume and character. All the peripheral pulses are well felt. There is no radio-radial or radio-femoral delay, no vessel wall thickening. Coming to the pulse examination techniques, palpation of radial artery, it is usually done by three-finger method. The radial pulse is felt using three fingers. Distal finger prevents the backflow. Proximal finger stabilizes the artery on the bone, and middle finger is used to feel and count the pulse. Another accepted method is palpating the pulse by two fingers. We have to calculate the rate of the pulse, that is radial pulse, for full 1 minute. Normal heart rate is 60 to 100 beats per minute. When the heart rate is less than 60, we call it as a bradycardia. When it is more than 60, we call it as a tachycardia. The causes of bradycardia and tachycardia are both physiological and pathological. Among the physiological causes of bradycardia, bradycardia is seen in the athletes and also in the person who are in sleep. The pathological causes of bradycardia are severe hypoxia, hypothyroidism or mixed edema, obstructive jaundice, hypothermia, sick sinus syndrome. When the patient who are on drugs like beta blocker, calcium channel blocker like verapamil and digoxin, patients with heart block and raised intracranial pressure can have bradycardia. Patients with raised intracranial pressure, hypertension with bradycardia, this triad is called Cushing reflex. Coming to tachycardia, the physiological causes are tachycardia is seen in infants, children, emotional states, anxiety, exertion, and pregnancy. Pathological causes are tachyarrhythmias, high output states like severe anemia, thyrotoxicosis, beriberi, Paget's disease of bone, cirrhosis of the liver, AV fistula. Tachycardia is also seen in patients with cardiac failure, cardiogenic shock, and patients who are on the drugs like atropine, nifedipine, salbutamol, terbutaline, nicotine, and caffeine. How are the pulse and temperature related? It has been seen that for every 1 degree Fahrenheit rise in temperature, the pulse rate increases by 10. Relative tachycardia is a condition when the rise in 1 degree temperature raises the pulse more than by 10. Relative tachycardia is seen in patients with acute rheumatic carditis, diphtheric myocarditis, and tuberculosis. Similarly, relative bradycardia is a condition in which for every 1 degree rise in temperature, the pulse rate does not increase by 10. Relative bradycardia is seen in yellow fever, dengue fever, patients with typhoid or enteri fever in first week, patients with pyogenic meningitis, intracerebral abscess, conditions like brucellosis, legionella, psittacosis, typhus, Q fever, and leptospirosis. Patients on beta blocker can have relative bradycardias. Other non-infectious causes of relative bradycardia are lymphoma, factitious fever, and drug fever. Mother Teresa has said, every time you smile at someone, it is an action of love, a gift to that person, a beautiful thing. With this, I conclude my today's topic on pulse rate. In next video, I will come with how do we see rhythm or rhythm in a pulse. Thank you. Keep learning.